Welcome to this comprehensive video on the clinical indications for stress echocardiography by physical exercise, a powerful diagnostic tool used to assess heart function and diagnose or evaluate various cardiac conditions. Let's start with the evaluation of coronary artery disease, or CAD. Stress echocardiography is often used to diagnose CAD in patients with chest pain or other symptoms suggestive of heart disease. This test helps determine whether the coronary arteries are supplying enough blood to the heart muscle during physical exertion. For those with known CAD, the test can also assess the extent and severity of the disease by evaluating how well different parts of the heart muscle receive blood during exercise. Additionally, for patients who have experienced a heart attack, stress echocardiography is crucial in assessing the impact of the heart attack on the heart's function and in planning further treatment or rehabilitation. Next, let's discuss the assessment of exercise-induced symptoms. Stress echocardiography is invaluable for patients who experience chest pain or angina during physical activity. The test helps determine whether this pain is due to insufficient blood flow to the heart. It's also useful for patients who experience unexplained shortness of breath during exercise, helping to identify whether the cause is related to heart function. In cases where patients have exercise-induced arrhythmias or abnormal heart rhythms that occur during physical activity, stress echocardiography can assess these as well. The test also plays a significant role in the evaluation of valvular heart disease. For patients with known conditions like aortic stenosis or mitral regurgitation, stress echocardiography helps evaluate how well the heart valves function under stress and the impact on the heart's overall performance. This information is particularly important in surgical planning, as the test can help determine the need for valve surgery by assessing valve function during physical stress. Another important indication for stress echocardiography is preoperative cardiac risk assessment. Before undergoing major non-cardiac surgery, especially for patients with risk factors for heart disease, stress echocardiography can be used to evaluate the risk of cardiac complications during surgery. The test is also valuable for monitoring response to therapy. For patients who have undergone treatments for CAD, such as angioplasty or coronary artery bypass grafting, stress echocardiography can monitor the effectiveness of these treatments and the heart's response to exercise. It's also useful in managing heart failure, where it helps assess the heart's functional capacity and the effectiveness of therapy. Stress echocardiography is also crucial in the assessment of cardiomyopathy. In hypertrophic cardiomyopathy, or HCM, the test helps in the diagnosis and assessment of the severity of the condition by evaluating how the thickened heart muscle responds to exercise. For dilated cardiomyopathy, the test assesses how well the heart pumps blood during physical activity and helps monitor the progression of the disease. In cases of unexplained syncope, or fainting, stress echocardiography can help determine if the cause is related to inadequate blood flow to the heart during exercise or an exercise-induced arrhythmia. Finally, the test is used in the assessment of pulmonary hypertension. Stress echocardiography evaluates the heart's function in patients with known or suspected pulmonary hypertension, particularly assessing how the heart responds to the increased workload. In summary, stress echocardiography by physical exercise is a versatile and valuable tool in cardiology. It provides critical information that helps in diagnosing, managing, and treating various heart conditions, ensuring that patients receive the best possible care. Thank you for watching. If you think stress echocardiography might be right for you, or if you have any concerns about your heart health, be sure to consult your healthcare provider.